All right. Well, we have a top 10 article today we're going to review.
Excellent.
Let me see. How can I share my screen? There we go. There we go. All right. So the title of this article is The Effect of Accident Mechanism and on Initial Findings on the Long-Term Course of Whiplash Injury. So this is one you probably want to buy and maybe keeping your top 10 binder. This is with Dr. Matthias Sturzenegger, who's a neurologist. He's from the Department of Neurology at University of Bern, Switzerland. And his co-author is the guy named Radnoff. Now, Radnoff is a real big guy. Both these guys are really strong in the field, top echelon guys. Di Stefano, the third guy, so he's like a third wheel in this one. He's a little step down from the other two. All right, so I'm just going to read the abstract and the results here, and then we'll get into the details.
All righty.
The aim of the study was to assess the relationship between accident mechanisms as well as initial findings in the long-term course of whiplash injury. A representative sample of 117 consecutive patients followed by primary care physicians was followed up over 12 months. So again, these guys are neurologists, so these patients are referred by the primary care physicians. Fractures or dislocations of the cervical spine, head trauma, and pre-existing neurological disorders were exclusion criteria. So these are going to be some of your worst cases. So keep that in mind when thinking about these results. The interval between the accident and baseline examination was 7.4 days. Assessment included accident features such as passenger position in the car, head restraint, head position, type of collision, initial symptoms, intensity and onset of pain, symptoms of neurological dysfunction, multiple symptom score, and signs, restricted neck movement, neurological deficits. At the one-year examination, patients were divided into an asymptomatic and symptomatic group and were compared with respect to the accident features and baseline findings. 24% of the patients were still symptomatic after 1 year. Now, keep in mind, again, they excluded a lot of the worst patients. So still they got 24%. Analyzing accident mechanisms separately, rotated or inclined head position was the primary feature related to symptom persistence. All right, key point. Symptomatic groups also scored higher at baseline on multiple system rating, had a higher incidence of initial headache, neurological symptoms together with a higher intensity of headache and neck pain. So they say the following set of initial variables predicted persistence of symptoms at 1 year: intensity of neck pain, headache, rotated or inclined head position, unpreparedness at the time of impact, and car stationary when hit. In conclusion, accident mechanisms in the initial findings suggest that more severe injury was significantly related to long-term persistence of symptoms after whiplash injury. So a lot of this stuff fits in really well with our previous discussions.
Yeah.
Now, the one thing they don't have here is pre-existing arthritis. So they didn't go much into the situation of the patient when they got into the accident. So this is mainly, the other factors. So I'll read a couple of notes here. The prognosis of common whiplash injuries without fracture or dislocation of the cervical spine is generally good, and almost 3/4 of patients recover in 6 months. That, again, that's not the best number you've seen. We've seen way over after a year, even after 7 years. Sometimes it's not even that good. However, the remaining 26% have symptoms persisting more than 6 months after injury and represent an important diagnostic and therapeutic problem for clinicians and legal medicine. Have these patients had more severe injuries, or the injuries which are unrecognized or unresolved, or either they physiological frail or psychologically frail or even conscious malingerers? And that's always the question in these cases. So that's good they brought that up. So let's get into some of the findings here. So assessment included accident features. So passenger position, head restraint, head position, and type of collision were the factors here, and they said that head position was number one. All really good stuff there. Now, they said it's number one. They didn't say it was the only one either. So head position is key. So what do we talk about head position? We say if your head is turned, that is the number one thing that we talk about. It's the first thing, one of the first things I ask when people come into the collision. So were you looking in the rearview mirror? Were you, looking in the side view mirror? I usually ask them the question to try to force an answer. I say, were you looking in the rearview mirror or the side mirror? I don't give them the option straight, because a lot of people default to straight. And so I usually get a good answer there, because they say, oh, I was looking straight ahead, even though it wasn't one of the options. So I know that I can have pretty good confidence in that answer. Initial symptoms: intensity and onset of pain, symptoms of neurological dysfunction, and multiple symptom score. So this is something you'll see in my reports now. In the crash factors, I will go into these things. I'll say that, patients came in with severe headache, and severe headache at the onset at the beginning of a crash is indicative of a poor prognosis. Multiple symptom scores. So this is people who have 1, 2, 3, 4, 5 complaints. Our most recent, that lady, the nurse, she had multiple symptom scores. She had like 4 or 5 areas of complaint. And then signs: restricted neck movement and neurological deficits. So, as I already talked about, rotated or inclined head position was the primary feature-related symptom persistence. The symptomatic groups scored higher on baseline on the multiple symptom rating and higher incidence of initial headache and neurological symptoms, together with a higher intensity of headache and neck pain. So these are all real good common sense things, but it's nice to have an article that you can say, Dr. Sturzenegger, the neurologist, this is what he says, and if anybody wants to call you on it. This is one of you ones you're going to have in your top 10. It's got a bunch of good nuggets in it. There's the chart there on page 446 is excellent. They talk about, it'll give you all the numbers who are symptomatic at a year. Unpreparedness is one we talked about several times in the past. All right, that's another one. And you'll find people got this, the few that are prepared. It's just plain as day most of the time that they have less symptoms. They saw it coming. Even if you don't consciously are able to protect yourself, there is definitely a bracing effect that, if you've been hit before, you look at the car in the rearview mirror like, uh-oh, something's coming here. Which also brings you to you got a comment about, there's, those 8 or so references that they always cite when they did a crash test with 4 cars, and now they extrapolate to the whole world about, rear end crashes. Well, the fact is, all those people know they were in a car accident study. So they knew they were going to get hit. They might not know when, but they knew they were going to get hit. So that's one of the ways you can attack those really terrible studies. They usually have like 8 guys. They're usually all healthy, like athlete types. And then they get hit. They're like, oh, they didn't get hurt. Well, no kidding. They knew it was coming. They were like, 6 foot, something males, who are, from ages 18 to 24, and of course they're going to have a lesser incidence of being hurt.
Yeah.
And then you have your client who's, a 40-year-old young lady, who's 5'2" and 105 pounds, and they're like, oh, they couldn't have got hurt.
Yeah.
It strains credulity. Good. Questions?
So far on this, no.
Yeah, it's just a real good, solid study to have as background, to have as something you can really hang your hat on. And these guys are no slouches. I mean, these guys, Sturzenegger is one of the top reference researcher in the whiplash world. He's a neurologist.
Yeah.
And just a real solid study.
How do you spell the name?
Sturzenegger?
Yeah.
Sturzenegger.
Okay.
And the other guy is Radanov, Raganov. And Sturzenegger is Matthias, and Radanov is Bogdan, Bogdan.
Okay.